thank you so much for your response on first episode of OPD Diaries case discussion. And in today's episode, we have with us Dr. Rikhit Jain. He is PGT from Department of Case Taking and Repertory, and he is from Pune, Maharashtra. So, welcome, Dr. Rikhit.
Hello everyone. Thank you Dr. Heena for giving me this opportunity. So today I will be discussing two dermatological cases. Both are the cases of pitted keratolysis. Now what is pitted keratolysis? It is basically a bacterial infection, especially the Campylobacteria species, on the stratum corneum, which is the outermost layer of the epidermis. This is presented as dugs or holes on the palmar or the plantar surfaces of the sole. So this is usually found in those people which has constant exposure to humidity around the soles, like farmers or athletes, and those which are working in the household areas. So in that cases, I have seen two cases in this NIH OPD, where first was a male case of 39 years of age. He presented with this complaint as on his right foot there were dugs on the sole of the foot with slight pain and offensive sweat. He had history of eruptions which he had applied ointment on, plus he had other generalities like desire for sweet, has diarrhea or stools in the morning, with problems like he had hot flushes, or he was aggravated by warmth. Whenever he used to get heated in the sun, he used to get irritation in the body. It's like itching all over the body. With mind symptom. What was the mind symptom? He was constantly theorizing, like, is this because this thing is happening because of some reason XYZ in my home, something of that. Because of that, things are happening to me. In this totality, I took and I gave the remedy sulfur, because prominently I got a history of suppression of eruption. So I gave sulfur 1 and 3 doses in first 3 days, post which repeated with placebo. After 2 months, the patient came and showed visible results, showing that the dugs or the holes which were there on the surface of the plantar surface of the foot were reduced. And after 1 more month, after giving satellite 3 doses, as the patient was improving, the patient came after 1 month and the improvement was totally visible. Next patient was a female patient, came last month. The female patient was a household wife. She had similar complaints on both the surfaces of the foot as well. She had complaints like menstrual disorders, like where the menses were very scanty. She had aversion to sweet. She was an obese patient. She was a chilly patient. So on the basis of that, I gave her graphitis 0/1. And post 1 month, this month she came, the eruptions has reduced as the treatment is still going on, but the improvement is visible. So in homeopathy, pitted keratolysis, now what is important? Main pitted keratolysis needs treatment. If you will see articles in various websites, like in the NCB website, you can see articles where the patient has been given antibiotics for the topical antibiotics for this particular disease, where if not better or if recurred, they are given systemic antibiotics like clindamycin, like internal antibiotics. So this, it doesn't heal on itself. It does need medication. We can show visible results in these cases, as it is very common in such patients, those who are farmers or athletes. Second, dermatological cases in homeopathy plays a vital role. Why vital role? Because they show visible results of homeopathy. So these were the main two cases which I discussed with you. So, and now thank you Dr. Heena for giving such a good platform, so that everyone gets to know what is homeopathy and how results are visible, especially for students. When they see the results, they believe in homeopathy, they start practicing homeopathy themselves. So thank you, Dee.
So, those are very interesting cases. Thank you so much, Dr. Rikhit, for sharing these cases with us.
Yes.
Just to ask
Yes.
about dermatological cases. So I think in all cases diagnosis is important, but more important it is in dermatological cases, because if we misdiagnosis, I think the management part is that is mismanaged. Okay,
Yes.
so for management, diagnosis is very important. So and you would like to put some light on the potency selection in these cases.
Yes. So first, as she said, diagnosis. Why diagnosis is important? First is, as we all know, for management, because management in cases like, if I have misdiagnosed a case of psoriasis and I'll tell the patient ki, okay, yeah, it will get better in 3 months, it will get better in 2 months, the patient will start believing that, okay, my doctor has said psoriasis will, this lesion will get better. But as we all know, psoriasis is a long term disease, it will take time, and if the patient sees no improvement, he will stop believing in homeopathy. So first, when we know the disease, that is, we know the diagnosis, we can set a plan, we can tell the patient or explain the patient how much time it will take and what is the course of the disease. Second is, if a lesion, if we don't know the diagnosis, so try to rule out what are the morphological features of the patient presenting. Like if it's a macule, a patch, it's a crust, it's a scale, on which basis we can, if we are not getting a totality, we can take those morphological features and search in the repertoire.
Yeah.
Like we have eruption, skin eruption vesicular, skin eruption crusty. So on that basis also we can select a particular remedy.
That is what now we have a literature rich in all these things.
Yes.
That is why we need to know the diagnosis, because in repertory we have
So many
rubrics,
rubrics.
Related to this, and we can find remedy very easily.
Yes.
We can get.
And as diagnosis also, the terms, like for example in boric, today what terms we use now, like for example herpes zoster, in boric they have used zona. For ringworm, what we use today is trichophytosis or herpes zosteratus. So these terms will have to take dictionary and search in the repertory, boric's repertory part, and rule each and every, try to find out what are the word meanings. Second is, the another part is, misdiagnosing a case will lead to failure to the patient itself, and it's not the failure of the homeopathy, it's the failure of we not diagnosing a case. So try to rule out or first diagnose the case and symptom on the basis of which can be selected remedy. And second is the potency part. Potency part is, if the patient has history of various ointment, the patient's history has lots of medications for a particular disease, like for example ringworm, the patient has been taking lots of ointments, the eruptions were coming and going on that, and only presenting complaints are just eruptions, no other generalities, no physical or mental generals, then try to use lower potency. Whereas if the patient, it's a fresh case, for example in Hahnemann's mental diseases, where some mental trauma happened and post which corporal disease came, like the skin disease. So, and if you are getting that mental prominence, the symptoms prominent, try to give a higher potency. So that's what I do in my OPD. And in NIH, we all are blessed like for getting so much of patients, and they have a lots of trust in homeopathy, which it's a fuel for us to go forward. Thank you.
That was a really interesting learning, and as you said, we have so many rubrics in Boric's repertory.
Yes.
And I really hope someday we can discuss that
Yes,
too.
yes, yes, sure.
So that was all for today. Thank you so much,
Thank
Dr.
you.
Rikhit.
Thank you, Dee.
And thank you so much everyone for watching. See you all again in next episode.
Thank you all.
Till then, take